How's it going? This is Sebastian Gonzalez, Dr. Sebastian Gonzalez with Performance Place Sports Care. This is a part of our ongoing series on how to modify activity and lifting with certain types of conditions, injuries, or pathologies. We're not going into the conditions and how they happen as much as ideas that we use in the office to modify around it so the person or athlete doesn't become deconditioned while they're waiting for this condition or the structure to heal. In this case, we're going to be talking about wrist. Other videos we've talked about chondromalacia patella, we talked about low back pain, shoulder impingement. Gosh, I know there was one more we probably used. I think it was elbow. But this one is going to be, there's lots of wrist conditions. Cysts could be in there, there could be dislocations, there could be strains, there could be a lot of things. So take this as a grain of salt. Just make sure you bump or you talk to your healthcare provider, your sports injury doc, or your strength coach about these ideas, and they might or might not throw it into your program. So the things we like to modify with is if you're doing cleans, you might want to do clean pulls. Clean pulls would not require you to get into the front rack position. The standard front rack position, a lot of times if people have low wrist mobility or actually shoulder blade mobility, or even shoulder mobility, the GH joint, they can't get their elbows high enough to decrease the amount of strain on the wrist because they'll weigh the whole thing, they'll weigh the whole bar on the wrist and it really cocks it back. So a lot of times you got to keep that elbow high. Second thing we're going to do is an alternate front rack position for front squats, because a lot of times you want to add front squatting, and I have no complaints with that, but there's no reason to shred your wrist apart in regards to accomplish that. And the last thing is a modification of push-up. Now, keep in mind with the other videos we spoke about, there is a need a lot of times to decrease the amount of load, but also increase the muscular time under tension. Also change the joint angle slightly, and we'll show you a variety of push-ups which would accomplish this. So enjoy, and please share with some friends. Now the first thing we'll add is if you want your power development, cleans and catching into the front rack position is going to be very painful with wrist conditions, especially if you're not catching it correctly. So what you might want to do is just do clean pulls. So she's going to demonstrate these here. You're still getting some of the power aspect of it, but you don't have to, you're not requiring the catch. Notice she's keeping the bar very close to her body. She's finishing with hip extension, or she's got the hip extension going. And again, the weight is light enough now where she can tolerate that eccentric load on the rest of the shoulder girdle and lower back as well. So some people do these and they pull and drop, which is perfectly fine. You might want to do that with some higher weight. Give me one more just for demo. Good. Now we spoke about before was having the issue with the front rack position on a front squat, and a lot of beginner lifters will have this issue as well. Actually, show the position of a typical front rack. So a lot of times when people don't have the elbows high enough, they're also going to strain the wrists as well, and also releasing on the fingers as well. Here is what a lot of people do to get a little more range. But again, beginner technique sometimes is a little bit of an issue. So sometimes you can get into a different position. I actually don't know the name of this. I wish I did. But this seems to work well for me. Surprisingly, though, this actually simulates, when people have shoulder conditions, this simulates one of our orthopedic tests. So they might have issues with that. Shoot, I better back up on you. So go ahead. Notice she's still keeping the elbows high, but there is basically no wrist requirements. Don't squat yet. So let's take a look here. So the wrists are straight. She's mainly just holding the bar really close to her neck is all she's doing. So this is just enough to secure the bar and get the squat properly. Go ahead. Next is something we're going to have an issue with. This will probably be actually better on women or people that can't do full push-ups, but modifications of the wrist position in. Actually, we'll look at this angle. So this is on this push-up modification. Look at the wrist angle. It's less severe than. Give me a full, bring your shoulder over your hands. So notice the angle here, and this is on a typical push-up. So sometimes relieving just that minor overpressure is enough to get people's wrists to chill out a little bit. So give me some push-up modifications. Again, just like any other exercise, you can modify range of motion, load, or time under tension. So we can basically just crush her with, make her do about a 15-second descent, so give me a real slow rep. And especially in this range, when the elbow bend gets significant, then she's going to really have some issues, and give me about a 15-second ascend as well. So this is a lot harder. Again, changing the muscular time and attention. They're still going to get work done, but they're going to save the joints that they're having issues with, and hopefully they'll keep some muscle on them while they're repairing the other types of conditions. Hope this was helpful. Again, this is all intended to educate, not necessarily to formulate programs for you. If you do want program design, you can always contact us at p2sportscare.com. Again, it's p2sportscare.com. Or you can listen to our podcast on iTunes. It's Performance Place Sports Care. We try to put a lot of free stuff out there for you guys, but ideally when it comes down to specific conditions, a lot of times you have to go to someone. We see sometimes people for a few times just to kind of generate these ideas of what works for them individually. So again, Sebastian Gonzalez, take care.